my name is Chelsea, and I will be doing a respiratory arrest video today. So, first, this is our little child here. He's going to be sedated for a procedure. So, we are going to set up the room first. First off, we want to have the O2, so we grab the correct mask. This is the child mask, and we want to open it up. Once it's open, we are going to connect it to the O2. And we're going to turn it to 4. Once it's at 4, we just want to make sure it's working, so I do feel air coming out. And we're just going to leave it at the top of the bed until we need it. Hanging right here. Then we want to make sure we have the right the bag mask that fits the child. This one is the size 2 and it says small child on it. So this is the other oxygen, and we want to turn that up to 10. And you will see this starting to inflate, which means it is working. So we just leave it up there for when we need it. This is our vitals machine. We just want to make sure it is turned on. And then we are going to grab a blood pressure cuff, which is the size for the patient. So this is a child size. And we are going to plug it in, which is right here. It just pushes right on. And this is the O2 monitor. So we're just going to plug it in. And it just snaps in. And then this goes over to hold it. Next is the electrodes. So we're going to take the electrode stickers and we are going to place it on the wiring. So right here, it doesn't matter which sticker goes on which one. And they just snap on. Okay. So once that's done, we want to get the CO2 monitor, which is right here, and it just snaps in this way. And we're just going to leave this up here for when we need it. Sometimes we can tape it because it doesn't like to stay. And then once that's happening, we are going to place all that equipment on the patient. So everything connected here, besides the CO2 monitor, is what we are going to connect. So this will go on the patient's arm. The O2 monitor will go on the patient's toe, his big toe here, and we can tape it if the patient's moving around. And then we want to place the electrodes on for the cardiac monitor. So, first one would be white and right. So we want to put it on his right side, right up here by the clavicle. And the other side is going to be red and black. And these go on the left, so what we want to do is smoke over fire. So smoke will go, so the black will go right beside the white one. And the red will go down by the lungs. So right there. And on this, when it is connected to a real patient, we will see an O2 wave. It's going to be a nice wave here. And as well as we're going to see a blood pressure reading here, and the cardiac, we will see the electrodes for the regular cardiac rhythm. So once that is going on, the anesthesiologist will put the child to sleep. And here in this clinic we use propofol, which is either a slow infusion, IV infusion, or it is an IV push that the anesthesiologist can push as the child is sleeping throughout the surgery or the procedure, whichever we are doing here. And then now the child's asleep, so we're going to grab his mask and we're going to place it over his face. CO2 monitor will just be placed right in here, right over his mouth. Or if he's a nose breather, we can put it over his nose. We just want to make sure it's registering a breath. And so on here, we will see a nice wave as well. And I talked to the anesthesiologist and they said there doesn't matter what number comes up, usual it's 20s or the high teens, as long as it's registering any breath on there is what they want to see. So as the child is sleeping here, we're just going to monitor the chest rising, and we're going to monitor the vitals machine to make sure everything is still in the normal range. Once the child starts going into respiratory distress, we're going to start seeing an increase in his breathing, an increase in his heart rate. We might see a sternal tug, which is right here, and it increases. You'll see like a hole, or nasal flaring. Once a child goes into respiratory distress, what we are noticing is the child will stop breathing, so we'll stop seeing the chest rise. We'll also see on the cardiac monitor, the wave will stop and it will register no breath. And the O2 sat is the one that decreases the slowest and takes the longest to even register that he stopped breathing. And then once that starts decreasing, we'll see it go down from 90% and on. So once that happens, we're going to call a code blue. And we're going to take off the oxygen mask, and rescue breathing will be started. So this is when we grab our lovely mask up here, which is set to 10 liters per minute. And we want to make sure we do the head tilt chin lift. And before we want to give a breath, we just want to make sure we don't see any obstruction in the mouth. So if we do see something, we can scoop it out with our finger, or we can use our suction over here and we can get out all the mucus. So if we don't see anything, we maintain the head tilt chin lift, and we start with the rescue breathing, which is 1 every 3 seconds. So you want to make sure we get a nice hold, and it's in a C. So your thumb is at the top, your 3 fingers are here, and tilting the head up. And we want to press a breath. 1, 2, 3. Breath. 1, 2, 3. And we're just giving enough air that we see the chest rise and we don't cause gastric distension, which would be the belly rising instead of the chest. So once this is happening, we are going to check the pulse. We want to make sure he's not going into cardiac arrest. So in this video, he's not. We're just going to have the respiratory arrest. Since there's other people in the room, we can get them to check the pulse. And on a child, we do it in the carotid artery, which is in the neck. So we'll just maintain every 3 seconds doing this until spontaneous respirations do return. And then once that happens, or the code blue team arrives, then we can hand it over to them, or once the patient starts breathing again, we will stop the rescue breathing, and we'll just continue to monitor the patient up here until they are admitted to ICU, and then once that happens, in this case it's a child, so it's PICU, and then they'll be admitted there and be monitored for the rest of the evening and probably the next day until they're stable enough to go home. So thank you for watching my video, and I hope you learned something.